we will shortly go to the Supreme Court as academics, CSO leaders, law professors, even doctors, physicians, surgeons are questioning the justice and justness in the Supreme Court's decision that says Jean Mensah or any witness in any matter for that matter cannot be compelled to adduce evidence. Let's go to Parliament and hear how the people who were at the helm and are seeking once again to be at the helm sounded clueless about people paying as much as $150 for an antigen test at the airport.
The Fees and Charges Act, you're a senior member of this House, requires that the $150 should have been brought to this House for approval. It wasn't brought to this House. The Health Institutions and Facilities Act 2011, Act 829, requires, under the first schedule, section 11.2, that clinical and biomedical laboratories must be licensed before they operate. When they started operating on the 1st of September, I have obtained the certificate from the Health Institutions, Health Facilities Regulatory Agency, known as HEFRA. They only licensed them on the 3rd of November 2020. So by the time they were operating at the airport, human lives were at stake. They had not been licensed. Minister of Health, are you aware of these clear infractions of our laws?
Honorable Chair, in the pandemic, we had a phrase we were using that we were not in normal times. There were certain things that we had to do and try to rectify and find out that this hasn't been done. And I said, no, quickly, let us go and rectify the anomaly before things get worse. So when people are dying and people are flying and people want to visit wives and husbands and they can't go, and we needed to open the airports, and we had to put in place something immediately for them to be able to be screened to try to stop importation of the virus into our country. Honorable Chair, I must admit that some things might have done.
Couldn't Noguchi have done that?
You know, no normal instance, and that is why we. Somebody is bringing you money. You go and ask them, where did you find the money?
Earlier in your answer to the Frontier Health Care Services Limited at the Kotoka International Airport, did I hear you say that that services was procured by the Presidential Task Force on COVID?
Yes, I did say so.
Are you a member of the Presidential Task Force on COVID?
Yes.
So if you are a member of the Presidential Task Force and you were going through this contract, are you saying that you didn't know the details of the contract that was being given out or that was being done?
Honorable Chair, the Presidential Task Force was actually started by me from the ministry, the early stages of the onslaught. I said I was creating an inter-ministerial committee. But then the first two meetings I called, my colleagues wouldn't come. So I told the president that he should take over that inter-ministerial committee to enable us engage. And that created the Presidential Task Force. Okay. Then the task force, a very large thing.
I don't dispute that. I mean, whilst the task force was going to embark on an health
we had
project,
separate functions for separate groupings and committees within the task force.
And are you telling this committee?
And there was created a
Minister, if you let us have a conversation that those listening to us and we in the committee can follow, it will be useful. And you are telling this committee that as a Minister for Health then, and they were procuring a health service at the airport, you were not in the known.
Yes.
Is the Presidential Task Force on COVID an entity?
Where entity means?
Where they can procure. Because you know it's only an entity that can procure. You've been the former chair of the Public Accounts Committee.
No.
So So how did they procure if they were not an entity?
They did that in collaboration with Ghana Health Service.
So are you then suggesting that it was Ghana Health Service that front the procurement of this service at the airport?
To interrogate that matter.
When you say you interrogate, what does that mean?
I'm not very privy to the initial stages of procurement. When I got, they finished arrangements with it, and they came to my notice. I was more interested in getting the facility set up and providing Port Health officials to man the facility. That is when I came in. I didn't go back to interrogate these matters to the extent that you want me to answer. And that is why I'm saying that I have to get back to interrogate.
Okay, earlier you also said that this group didn't even have a license. You have to encourage them to go and register. Is that right? Yeah, so when they were registering, did you bother to find out their nationality?
No, please.
And after subsequently, when they were operating and there was a lot of press conferences and noise by Ghanaians or protests or complaints by Ghanaians, as the health minister, did you pay attention to the press conference or the complaints that Ghanaians were making with regards to their operations at the airport?
Yes, I did. And that has resulted in the reduction of the fees for at least ECOWAS citizens.
Right, so Kokua John Menu there, do you think that he passed the accountability test, or that because of COVID, it was okay? Was he frank in your estimation about it, even if it was because of the exigencies of COVID? Joining us for this segment also and going into the Supreme Court, Gabby Asari Otre Dako, a senior partner, Africa Legal Associates, and member of the NPP. Gabby, thanks for making the time to join us.
It's been a while.
Yes, great to have you.
5 years or something?
Yes, it's been almost. Right. Also here is Sammy Gyamfi. He's National Communications Officer of the NDC. He's also a lawyer. Thanks for joining us.
Thanks for having me.
Great. We'll be joined shortly by Oliver Mausi Baka Vomawo, who is researcher, Corpus Christi College, University of Cambridge, and Chief Technical Advisor, University of Ghana School of Law's Democratic Vigilance Project. So, can we get you, the two of you, say a word or two, perhaps, about the vaccination and how people should cooperate with authorities so that we'll have a smooth process? What you may also think should be the communication, approach to it. I'll start with you, Gabby.
Well, personally, I think really the focus we all thought was on the AstraZeneca.
Right.
Now we've been told that it may not be that effective when it comes to the 501v2. I think
with COVID, things are changing on a daily basis.
So, but we've also heard that the Sputnik 5 may be more effective. So let's just wait and let's hope that the experts will lead us the right way. But I think it's important that the process of procuring the vaccine is expedited as much as possible. Yeah.
That's right. Yes, Sammy.
Samson, I think that the submissions...
You have millions of people who listen to you and take your words because of the vehicle that you guys control, political parties.
Unfortunately, some of us, I'm not sure, have the capacity to offer any advice on such technical issues. What I want to say is that the submissions by our experts who joined us this morning are very insightful and informative. I've learned a lot. I was making notes as they went along. And if what they have said is anything to go by, then we can all be rest assured that there is no cause for alarm and take their word, for what they are saying. And all I would say is that they should follow the process, keenly, and ensure that any advice they proffer to the citizenry and the people of this country will be accurate and not create any problems for us in the future.
Thank you. Start with you, Dr. Soji Tete. Why should we be fixated, concerned, as the MPs did, on, as you saw?
Well, I think that there are fundamental issues around accountability. The optics don't look very good, that on a matter of such national concern, the key players don't seem to have an awareness of how the whole matter rolled out. But beyond that, there are also substantive issues. So you've raised the matter of the procurement, you've raised the matter of accountability. I would want to look also at the matter of compliance, quality assurance. I mean, given my own biases. I know that eventually we did come through with a registration with the Health Facilities Regulatory Authority, which is good. It would be good to have some understanding of the role that was played by the Food and Drugs Authority to ascertain the quality of even the machine in doing the work that it's doing now. Because we have rigorous processes. The Ministry of Health has laid out clear policy guidelines on how labs operate in the private sector. So it's important that we do things in such a way that they are complied with. The matter of cost. I mean, I have always had concerns about the amount being charged. It is reported that Ghana is among the most expensive as far as these antigen tests are concerned at the airport. So again, it's welcome news that after all of the public, outcry, the amount is being reduced, both for Ghanaian citizens and for citizens in the sub-region. The third point that I would point out for me has to do with what I think of as a fragmentation in the leadership response. Because if you have the health minister, who is a member of the task force, who does not seem to be aware of some of these developments that you've alluded to, and you have a procurement entity.
No, the fact is, if you sit with the fact, he initially gives the impression of not being aware, but as he's interrogated further, he seems to modify his answer and eventually seem to want to suggest that there was actually a procurement entity through the Ghana Health Service. When he's probed further, he says we'll look into it. And like the judges do their work in the courtroom, they look at your demeanor in the responses. He didn't sound confident at all. Why do you think he would sound evasive or unsure and would modify, seem to vacillate from one point to the next as he's being questioned about it? What is there to hide, so to speak?
I mean, I cannot speculate on what would have prompted him to provide some of those answers. What we do know is that the company did start functioning prior to getting full accreditation. That is known, that has been pointed out. And he's also talked about the fact that he didn't have sufficient information. And we also have gathered information that the company had no real track record in administering some of these tests prior to being given this contract. So I think that they are legitimate concerns, and it is right that these questions are put on the table. But as to his motivation, I mean, I would like not to speculate, but they are legitimate concerns, and we are right to raise these questions from the perspective of accountability.
Dr. Abediaku, when you listen to the minister, he begins by seeming to suggest, I plead the fifth. Then suddenly, he shows that he has some knowledge, but it's incomplete. He says he was a presidential task force. Then later, he's asked, but you were a member of the task force. He admits that. So what are you talking about? Did you know that they didn't have these qualifications? They set up all of that. From where you sit, what does that communicate to you? Okay, Dr. Seydou Bekwai.
Yes, thank you very much. So I think that from our perspective, we we're looking at what is the deliverable when we have this entity doing what they're supposed to be doing. So we thought that if you look at the other option and the new one, we thought this one was good for practice, because the initial one was that when a traveler enters the country, supposed to undergo 14-day quarantine at the hotel at its own cost. And then we also do a PCR test. So this one, if this one can be done, and you get the results in 15 minutes, and you pay $150. In terms of cost, you save the traveler a lot of money, and you will also get the results early. So we, as a service, were in tune for it. In terms of the details, I think that the airport company is the entity that facilitated the process. So I think that they can answer most of the questions that you are looking for. Thank you.
All right. But from where the two of you sit as experts in this area, why should this be a matter of concern? Let's hold on with the questions of. Okay, so Dr. Abedi, you are back. Thank you very much. The question I was posing to you with Dr. Franklin Esedubekwe obviously may not be able to respond to as much as you may, is that, you know, listening to the minister, how does it feel?
I was a little bit surprised that he didn't seem to have as much information. Perhaps he has, you know, maybe he delegated some of that decision making to technical people on his team or the Ghana Health Service. That is probably something that Dr. Esedubekwe might be more easy.
He would have said so. He would have said so.
Well, I mean, that is for only the minister can really answer that question. I, as a Ghanaian, I can only just also watch and wonder. I mean, as a scientist, when asked about the airport testing, I typically would say, yes, it was really important that we needed to test. And that has been proven true by the sequencing work that we have done, demonstrating that indeed there were some variants. Even with our nets, a few slipped through, but it would probably have been worse without the airport testing. So testing at the airport was a critical step. And it was great that the government took that step. In terms of the antigen versus PCR, the issues I had were initially the test was being called a PCR test, which it was not. And I thought the messaging on that could have been clearer. But in terms of whether they were registered, I mean, of course, there are laws in this country that govern such procedures, and you'd expect that those laws would be followed. Even in emergency situations, you can accelerate review processes. You don't have to completely not have them. So this is a question for people, above my level, really. I mean, this is a question for the minister, for the Director General of the Ghana Health Service, for the people who make these sorts of decisions. It is a little bit concerning that oversight happened. I understand that it was an emergency situation, but I believe the FDA was on standby. They could have conducted reviews at breakneck speed if necessary to get the airport open. So a little bit puzzling that he was not aware. But as a scientist, like I said, I mean, I tend to deal more with the technical issues of, does the test do what they say it will do, and is it being run properly?
Okay, so I'll let the two of you go so that we will stay in the studio here and continue with our discussion. But my very final question to you and Dr. Sojitete is, the two of you, is, so I need to know the concern from a physician's or an expert's perspective, beyond the questions of accountability, that a setup is being put up at a time when they don't seem to have certain certifications, which will suggest that they may not have the requisite qualifications and so on and so forth. How much of a concern is that?
Oh, I would say it is a concern. As I said, the airport testing has proven to be a critical piece of Ghana's defense against COVID-19. And so it is critical that that piece is run properly and has the appropriate technology to deal with whatever threats is coming by way of the virus entering the country. Early on, when we talk about testing, it's all about the sensitivity of a test, how well the people have been trained to run that test. So all of those things have to be optimal to make sure that you catch as many people as possible.
All right.
The debate early on was about the sensitivity, 99% versus 87%, which what the manufacturer had claimed. Those are questions that, those in charge of making a decision would have to answer.
Okay.
But yes, from a purely quality management perspective, quality assurance perspective, it is key that these tools are implemented properly and that people are properly trained to administer them. So that is something that should not be taken for granted.
Thank you very much. Dr. Soji Tete, in 1 minute, what will be your final, comments on this issue? Specifically,
well, it's a quality control issue. It's a quality control issue. And you would recall that the initial cases that were recorded were imported, which is why reducing importation of cases was one of the key government priorities. We are also talking about new variants being recorded at the initial instance at the airport. So it is absolutely very critical that we do not compromise on quality control as far as the testing is concerned. And I know that the Food and Drugs Authority has very rigorous processes that should be applied to all labs that are set up at each point in time. So quality cannot be compromised.
Okay. Thank you all so very much. Let's get to the studio now. So since you are coming from the side of the opposition, you may have been privy to why the minority group, decided to focus on this part and then began to exact answers from key sort of cabinet ministers designate who were appearing, and they were drawing a blank on everyone else. What was the purpose?
The purpose is simple. We are talking about something that has become an essential tool for risk minimization in the fight against COVID. An essential tool for slowing down the spread of the virus. Here we are talking about testing. And so the affordability of that tool is very important because now it's become an essential service. And that is why in some countries, these tests are done for people for free. People don't even pay anything for it because of how important and critical it is to the fight against the spread of the pandemic. Now, we in the NDC have been very concerned about the cutthroat charge of $150 per antigen test being done by a company called Frontline Healthcare Services at the Kotoka International Airport. Because our investigations have revealed that the deal and the circumstances under which that company was engaged is shady, opaque, illegal, and that the terms of the transaction, the amount being charged for the antigen test is a ripoff. We think that what is happening is a clear case of profiteering, which should not be countenanced by the people of this country. And that is why we are using this vetting process to hold to account persons who are entrusted with the responsibility of ensuring that these things are done for the welfare of the people. Now, why do I say that?
Well, in Ghana, we are charging per passenger $150. In the UK, $200. In Benin, it's $160.
You see, I'm not too sure that what is done, because if you look at what I have before me, Malawi charges $25 per antigen test.
That's right.
Malaysia charges $28 per antigen test. India, at the Goa airport, charges $28. Heathrow, per my checks, and this is, I'm quoting this from the statement by Honorable Samuel Okudzeto Ablakwa, which he presented to Parliament. And let me commend him for the human job he has done on this subject. The charge there is $70. Okay, and that is antigen test. And you see,
initially, I'm giving you the cost. Initially, Ghana was the third highest.
Yes.
With the $150.
But currently, we are, if not the highest, among the highest in the world, because even UK has reduced their own to $70. And in fact, for some of these countries that we normally compare their charges to ours, some of them actually do PCR tests. And there is a difference between a PCR test and an antigen test. The PCR test is the golden standard, more expensive. Okay, and so if you look at countries like even Sierra Leone, they are doing a PCR test, which is supposed to be more expensive than the antigen test at $80. Senegal is doing PCR test at $75. Rwanda is doing PCR test at $60. Djibouti is doing PCR test at $28. Germany, $70. Turkey, $16. So why should Ghana be doing an inferior test, the antigen test, in this time at $150? And we have maintained, Samson, that this deal is shady and opaque because, like our members on the Appointments Committee of Parliament explained, number one, this company was hurriedly incorporated barely 5 weeks to the reopening of our airport on 1st September. Their incorporation and commencement date is 21st June 2020. So barely 5 weeks before His Excellency the President reopened our airports, this company was hurriedly incorporated. Now, at the time they were engaged and they started their operations at the Kotoka International Airport, they had not demonstrated any capacity in this biomedical science field. They had no functioning laboratory in Ghana, for example. So no capacity. Yet we ignored institutions like Noguchi, KCCR, who have been at the forefront of our testing regime since we recorded cases of COVID.
Did you say barely 5 days?
5 weeks.
After?
No, barely 5 days before the easing of restrictions, before our airport was open.
Thank you.
Because the incorporation was...
No, if you said before, that's fine.
Yeah, before.
I thought I heard after.
Yes, so immediately, 5 weeks before our airports were reopened, our airport was reopened, the company was hurriedly incorporated. No capacity whatsoever. Companies which were already conducting tests, leading our fight against this pandemic, like in Noguchi, KCCR, and other private players like Medilab, Lancet, who over the years have demonstrated admirable capacity in this field, were all sidestepped, and this company was selected. Now, till date, we do not know the entity who engaged or selected this company. The Minister for Health says that it is the Presidential Task Force. We know that per our public procurement law, the Presidential Task Force is not a procurement entity and could not have legally selected that company to do that job.
Right, the minister admitted that.
Exactly.
Yes, but he suggested that it could have been done through the Ministry of Health.
Then his own...
Even though earlier, Ghana Health Service, even though earlier, when Okujeto was the one questioning him, he has suggested that they didn't comply with the procurement law because of the exigency.
Yeah, and I'm going to deal with that because that for me is also untenable.
Yeah.
But his own deputy, it's instructive to know that his own deputy, Dr. Okoboy, said on the Joy Super Morning Show on Friday that it was another agency, the Ghana Airport Company, which selected this entity. So, the Minister for Health says the Presidential Task Force in one breath, then he says that it could be the Ghana Health Service. His deputy is now talking about the Ghana Airport Company. When they are asked whether or not they have cited the contract, they are totally clueless about that. The Minister for Foreign Affairs says he doesn't know anything about that. And what is even more worrying is the fact that this deal sins against so many of our laws, at least 3 of our laws. Number one, the public procurement law, because clearly, per the facts available to all of us, the public procurement law was not followed. The excuse that, people were dying, this was an emergency, is neither here nor there, because the public procurement law, section 40 and 41, makes provision for such emergencies. And if you have time, I can read for that. That in case of emergency, if you need to procure a service of goods, urgently,
you're right.
activate.
You're right. The law says emergency.
Exactly. And that is why the single source method, one of the reasons that is provided under Section 40 and Section 41. In any case, Samson, we recorded our first case of COVID sometime in March. It took us some days before we closed the airport. And when we closed the airport, we closed the airport for almost 6 months. So within 6 months, are these government officials saying that they couldn't write a simple letter to the Public Procurement Authority and justify why this entity ought to have been engaged through a single source procurement process? They didn't do all that because they knew that the company would not even have qualified to be engaged for this job, even under sole sourcing, under our law. So the procurement law has been violated, making this whole deal illegal. Number two, like Honorable Ablakwa said, the Health Institutions and Facilities Act 2011, Act 829. If we read Section 11, together with the first schedule of that law, specifically paragraph I, it is clear that you cannot establish such a clinical and biomedical facility without a license from the Health Facilities Regulatory Agency, HEFRA. Yet the facts show that between the 1st of September and the 3rd of November, when this company operated at the Kotoka International Airport and was charging this cut-throat charge of $150, they had no such license. And yet government officials looked on unconcerned, when there were serious issues of quality control, compliance, and all that. Again, the Fees and Charges Act is also very clear. And that law says that no entity, agency, or authority can impose any levy on the public without an approved LI by Parliament. So if you want to charge something, a fee, you go to Parliament with an LI. When the LI matures and it is passed,
the Fees and Charges Act
2018, Act 983. And our friends in government know this. Yet, for some reason, we have subjected Ghanaians in the diaspora, Ghanaians in this country who travel outside and come into this country, to this unconscionable, abominable, unacceptable cut-through charge of $150. And you see, something, the reason why we also say that that figure is a ripoff, apart from the fact that countries in Africa, sub-region, and across the world are charging less for an antigen test which is inferior to the PCR test. And even in cases where people are doing PCR tests, that is even cheaper than this.
But where you said that at the start when we're doing it in Heathrow, they were doing a superior
I was
PCR.
putting the current.
Yeah, but they were also doing antigen tests, really.
They were doing antigen tests, but now it's $70.
Okay.
You understand?
Okay.
And so I am saying that this deal has to be abrogated on grounds of illegality, on grounds of corruption. And we need to utilize...
Suspected corruption, you mean?
Alleged corruption.
Okay.
It's suspected because if the public procurement law has not been followed, the public procurement law is supposed to ensure value for money and check corruption.
Thank you.
If that is high-stead, then issues of corruption arise.
Thank you.
But I am saying that it should be abrogated, and let us utilize the local capacity we have in institutions like Noguchi, KCCR, and other local private Ghanaian companies, like Medilab and other, to do this at a cheaper cost. Because what is happening is profiteering, it is exploitative, it is punitive, and we must not accept.
Thank you. Now, Gabby, how do you explain what has played out in the public as far as this issue is concerned? I suppose you are not excited yourself watching and listening to these duty bearers appear to contradict themselves, appear clearly to show that they are unsure of things that they clearly ought to be sure about, and then feeding into a speculation that somebody is hiding something.
I think it should be clear as to where the responsibility lies. And I think if you look at it, maybe let me take it from a broader perspective before I get to the specifics. All across the world, there are issues being raised about the procurement processes because of the extreme urgency of this COVID issue and the direct awards. They have to work at pace and the rest of it. In the UK, for instance, there was a whole investigation, because I think within the first few months, about £18 billion worth of procurements were done by the government. So I don't see anything particularly unhealthy, about this exercise. So, but I think when
the other side of the coin, though, is that there is the argument that governments globally have used COVID as an excuse to do some wrongs. So that's where the suspicion, what feeds into the suspicion.
I agree. I agree that there are all these issues. Like I said, in the UK, there was a whole report done, and they ended up by saying that they understand the extreme urgency required, but that the laws must be tightened to create greater transparency. So this is a live issue across the world. And if you remember, we had closed our borders, and the government was moving to open the international airport. But on one condition, that those who were coming in will be first tested. And in many places across Africa, because I even had opportunity to travel to certain countries, they were doing rapid testing antibodies. And that was not good enough, because it can tell that you've been in contact, you've had it, but not necessarily that it's live. So I think what was topping this was, you talk about the PCR, and I've heard instances where we are being told that at certain airports they're doing PCR. And my understanding is that it takes hours for the PCR results to come in. So it is not necessarily the best option for an airport where you come with maybe kits and all that. So the antigen was the right way to go. And it had to be done, and under extreme emergency circumstances. And I think that my understanding, and I stand to be corrected, is that it's the Ghana Airport Company Limited, assisted by the Ghana Health Service, and of course, the Special Task Force on COVID. But the procurement, my understanding, and I stand to be corrected, but my understanding is that it is the Ghana Airport Company Limited. And I think the emphasis must be on the company, what? Limited.
Okay.
Okay. So I think really we can go into all that. There are two issues. One, you can question the procurement process, which I think is legitimate. And then two, you can also look at the price, which is also legitimate. But I think when you mix the two and then create the impression that there's something shady, there's some level of corruption and all that, without actually having the evidence. Because the numbers that you show, I mean, in the UK, if you're telling me that in some countries the same antigen is being used, but at this price, and bear in mind, we were among the first countries to do so. Is that not the case? If not the first, we were among the first countries to do so. UK took them, I think, 4 months or 5 months after we did it, before they started doing it. The difference between the UK and Ghana is that at least a lot of the stuff that they use are manufactured locally. Okay? So whichever entity is using it here, they have to import. And the infrastructure put in place at the airports, everybody spoke about it. So, but I think there are two issues. One, like I said, in the beginning, because no one knew how long we were going to be confronted with this disease. And if you look at, I'm sure you've been to the airport, you look at all the infrastructure that was required to put this in place. But I think it gets to a point where we can ask legitimate questions that, can we look at the price? Already it's been looked at for the purposes of ECOWAS.
Right.
But we can look at it because, I mean, I look at the situation where you are coming in with about 4 children, oh, well, not those who are supposed to do the testing, or a family of 5 or 6. And particularly, I heard the head of the AFTA also making comments about it, that if you're going to be in the center of Africa, then we should look at how we can make it easier for people to come in. So these are all legitimate questions.
All right.
And I think we should look at it. What I find uncomfortable is to talk about shadiness and the rest of it. Because I think really, from my understanding, if we go to the Ghana Airport Company Limited, which is the entity in charge of the airport, and I believe that they even get a part of whatever is paid. Perhaps we can get a better explanation from there. The Ghana Health Service can help us because they are involved, because they're nurses and all that involved.
I think it's a lack of the information that is creating all of this problem. And particularly when duty bearers who are supposed to know and supply us the information don't seem to have. But don't you think there are circumstances that feed into the suspicions that the Frontier Company was incorporated in July 21, 2020. It is owned by a Ghanaian company, Health Solutions Services Limited, incorporated in June 3, 2020. The people look at it, they say both companies have the same registered addresses, both companies have the same objects for their business. Both companies have the same directors, for example. And then the Health Solutions Limited is owned by a company that is incorporated in the Dominica, supposed to be offshore tax haven. So people are asking questions. What is really going on? Then the address they give to the Ghana Revenue Authority, when they check along the one in the offshore place, seems to be wrong. And they find Nigerian...
Seems to be or is wrong.
Okay, if I had the time, I could take the 2 documents and show you. Okay. Then they find a Nigerian in there, and then you hear these MPs asking the questions, but stopping short of saying exactly what their suspicion is. Meanwhile, they seem to have a suspicion that feeds into some cronyism between people in power and then whoever it is from Nigeria, and suggestions of people who may even be, you know, fugitives from justice who have millions,
I think
to invest and doing all of this.
I mean, 90% of the things you said is all new to me. But I think the most important thing is that it feeds us nothing nutritious.
Sunshine is the best disinfectant.
Yeah, by focusing on speculation. That's the point I'm trying to make. One, we talk about the entity being new. I mean, look, we have entities in Ghana that are now doing PPEs. Were they doing them before? No. This is an extreme emergency situation. Has anybody come to tell us that the services being provided by the entity, what's the name? Frontiers?
Frontier.
At the airport are below standard. Has anybody come to say that? I think let's really find a way. I find these things so uncomfortable when you have to talk. Let's find a way to if you like, pick the issues separately. Because what is important to us, one, is that we tackle this virus, and 2, that we do it in a way that's cost effective. 3, we do it in a way that doesn't breach our laws. All these are into one. Okay? So on the issue of when the company was registered or not, look, a lot of people, entrepreneurs, are going into this COVID business. There's absolutely nothing wrong with it. I mean, one of the key things that the president said, he made 5 things, is that we should be entrepreneurial about this thing. So as far as I'm concerned, there's nothing wrong, because I have so many friends, I'm sure you do, who are now, whether they are manufacturing masks or doing all manner of stuff. So I really don't think that is.
How do we bring closure to this, Bata?
I think we bring closure to this by actually those who are responsible, because even the company has CEOs and the rest of it. We can speak to them. If it's about the quality of services, they can answer that. If it's about the cost, they can perhaps answer that.
But it is government and the duty bearers that have a responsibility to Ghanaians.
I'm taking steps.
Okay.
So first of all, let's not create the impression that it is a ghost company. That I think it's not proper. It must have CEOs, it must have shareholders, and the rest of it.
Certainly.
So that's there. Two, which entity? Because there must be a contract. And that contract must be flexible enough that even when ECOWAS say that we want to charge $50, they are forced to comply.
Right.
Okay? I want to focus on, to me, what is most important is the cost. That's where I want to focus on. I want to focus on that because I want to make sure that even though we have COVID, and even though we have a system in place that is making sure that as much as possible, those who come in, they are tested and the test is authentic, and we can determine that they have COVID or not, and as much as possible, we can keep those who have COVID out, or we can.
And it's also important because we have many people coming through that entry point.
Precisely.
Right. And we have also identified many people who brought it in through that entry point.
Because look, there's always a gap.
That's right.
There's always a gap, and you can't be 100% sure. And even the test sometimes may not be foolproof. So there are all these things. But I want to, my focus personally, the procurement is important. I want to focus on the cost. That, look, they've been in existence for how many? About 6 months or 5 months or so? There's a lot of capital involved. But I think by now, one can make the argument that they've made enough to cover their costs. Can we look at the cost? Can it come down from 150 to, say, 100 or whatever it is? That's where my focus is. Secondly, I think the answers GACL must be in a position to answer some of these questions. Because I presume they're the ones who did the contract. And it's a company, by the way. And company has its own rules about procurement. So let's look at all that.
Thank you very much. I'm sorry, but we have to break here, return to go to the Supreme Court. And this is Newsfile, brought to you by Bank of Africa, strong as a group, close as a partner, MTN everywhere you go, Ashesi University, educating ethical and entrepreneurial leaders for Africa. Duraplast, where Duraplast goes, water flows, having mosquito spray and coil, pleasant on humans, tough nightmare on insects, and upper food is tasty. DBS Industries, Robert & Sons Limited Optical Services, your comprehensive eye care services provider. We will be right back, and when we do, we will go to the Supreme Court and find out if these academics, CSO leaders who have descended so heavily on the Supreme Court are justified in saying that the Supreme Court has done a big injustice in the manner in which it applied itself on the question whether or not the Electoral Commission chairperson ought to be compelled to get into the witness box to be cross-examined by Chachu Chikata. We'll be right back.